Hi guys, my name is Rafael Portugal. Um, Hope everyone's doing good. I am going to be talking about CT scan as my special modality focus today. CT scan is a very important and vital tool that's used in trauma hospitals, as well as clinics too, but more so in traumas with car accident victims, gunshot wounds, stroke patients, cardiac alert patients. Pretty much anybody and everybody that comes to a trauma facility will at some point go to CT scan, especially if traditional radiograph images don't show what doctors are looking for or they can't reach a diagnosis. So, yeah, let's get started, just a brief start. CT scan involves a x-ray table that we'll put the patient on, and they'll slide them into a big circular machine, very, very large machine. That circular machine is actually the x-ray machine, and it's able to capture two-dimensional x-rays on a 360-degree scale so that it can take multiple two-dimensional images from various, pretty much all angles on a 360-degree scale. And once the CT scanner takes those images, it turns it into certain data that can then register in a software, and that software will reconstruct three-dimensional images of the anatomy of interest that's being scanned from those two-dimensional images. So very, very complex system and software-wise. It provides great detail on images for physicians and especially ER doctors, that are looking for internal bleeding. They could be looking for cancel or nodules in the lungs. They could be looking for, all types of different things, various stuff. So CT working on that 360-degree scale around a patient really provides them all the angles that they need to be able to see all type of anatomy around the patient. And some of these CT scans, they can go from a few dozen two-dimensional images all the way up to sometimes 600 to 700 regular x-rays that a CT scan can take, just so that it can get precise and detailed 3D images for the CT techs and for the physicians. But CT is though it is very good for the detail images that it provides the doctors, there is a patient safety and risk factor, considering I just said it can get to almost 700 images in one scan. That's something to be considered, how many times a patient has had CT scans in their past and prior, how intense it was. There's a bunch of different types of CT scans that they have. There's not just one general type. Some of them that only require a few dozen two-dimensional x-rays are axial, like non-volumetric CT scans, which will be typically a lower dose, or they're just looking for tumor masses and cancers in the lungs. So it doesn't require a vast amount of images and angling to be able to see that. When we see a mass in the lungs, it's pretty apparent. And then there's helical CT scans, which take hundreds of traditional X-rays in these scans, but they overlap each other so that they can get really, really detailed and precise three-dimensional reconstructive images, so that they can see any types of fractures, any type of thing that could be going wrong and causing problems with the patients. There's also, when we're looking at the skeletal system, we're looking for bones and radiopaque type anatomy in the body. There's no contrast, no barium, or no iodine that's involved. But when it gets to more abdominal organs, internal bleeding, stuff of that factor, CT techs will administer intravenous contrast and contrast into other areas so that those organs and internal parts can be highlighted, making it much more easier to see the anatomy of interest and any other problems that could be happening inside of there. So, yeah. And again, just talking about different types of scans, there's, cardiac CT, which focuses on the heart and the blood vessels, CT angiogram, so they can see if there's any aneurysms or blockage in blood vessels. As I talked about earlier, multi-slice, so they can get multiple slices in a rotation and better image quality for that 3D reconstruction. Also, too, head CTs are very big. People fall, hit their heads, car accidents, assault, violence, people being punched in the head, being hit with blunt objects as well. There's, all those types of patients will go to CT scan as well. So, there's, some typical things that will make a physician send a patient to CT, different types of pathologies or different types of symptoms that they see. So, typically cancers and tumors with, like appendicitis or pneumonia. Like I said, head injuries are very, very common to see in CT scan because they look for, any type of skull fractures and internal brain bleeding. CT scan will show all that kind of stuff. Like I said, aneurysms and, embolisms, pulmonary embolisms, all types of blockage of blood flow. CT scan will show all that kind of stuff too. Stroke patients, trying to see if they can pinpoint the bleeding or the blocked blood vessels and see where exactly the stroke had been caused from. All those kinds of things will come through CT scan. So with CT scan, like I said earlier, biggest safety concern when it comes to a patient is just the amount of radiation they're exposed to. When you're hearing that one CT scan can get up to 500 traditional x-rays on one patient, some techs don't even shoot that many x-rays in a week, let alone two. So it's a very large amount of radiation for one patient. So as a tech, it is our responsibility to, look at past health history, look at past exams, consider the time of length in between those exams, and just making sure, we're looking out for the best interest of the patient and trying to decipher whether CT is really necessary, especially if they had been through so many times. Some more safety concerns that come with CT. Like I said, it's very common for trauma patients, so stabilizing the neck and the shoulder region for the C-collar and C-spine precautions. God forbid anybody has a spinal cord injury, you never, ever, ever want to leave their neck unstabilized because that could, damage the spinal cord and leave them paralyzed, potentially killing them as well. With trauma patients, a lot of unstable vitals, shaky blood pressures, respiratory rates being all over the place, different leads, different IVs, different wires, oxygen. There's a lot of different stuff that you need to consider when handling a patient at CT, especially because in order for them to get to the CT scanner, it always requires a patient transfer from a gurney in a bed to the x-ray table. And with that being said too, especially with respiratory rates, sometimes oxygen levels drop and you'll have to call a cold blue in the middle of CT. At that point, chest compressions are required. We need to, BLS license, we need to perform our CPR. So making sure you secure the patient on the x-ray table and they're properly secured before starting chest compressions is another thing to consider. And talking about contrast and non-contrast CT, some people have contraindications and are allergic to barium and iodine. So those are very important things to reflect in a patient's health history in their chart before bringing them back for an exam, so we can plan ahead and not get blocked up, because CT scan is a very, very busy modality throughout the day. I had read an article earlier this quarter, I believe it was week 3 or 4, where I did my homework and my reflection on it, and that's that. I want to talk about that article again because I felt like it was a really big boost for the world of CT. But I had read an article at the National Institute of Biomedical Imaging and Bioengineering, we're talking about FDA clearance for a different type of CT imaging machine, which I had talked about CT scanners converting two-dimensional x-rays into 3D imaging. This new CT scanner, instead of converting the two-dimensional images to data that then converted that data to three-dimensional, they had created a CT machine that was able to convert two-dimensional imaging and those multi-slices on the 360 directly into three-dimensional images in a one-step process. I think for the sake of results, radiologists being able to read images, I feel like that development is huge for the modality of CT scanning, because computer tomography is just, it's getting more and more popular. And like I said, if doctors can't diagnose off an x-ray and they feel like they need to investigate more, a lot of patients will go to CT. So being able to speed up that process and clean up image quality, because I'm sure with newer developed technology, limiting noise and all outside factors from the images will help make the image quality that much better. I feel like that was a pretty cool article to reference for the modality. So yeah, CT scan, very fascinating, very great. I'm excited to get to cross-train in the future. I would like to try to cross-train as soon as possible so I could take the board exam as soon as possible for that as well, but that's all in due time. So, always be considerate of the patient. CT scan can be very intimidating. God forbid, someone's never had injected contrast before and they have no idea if they're allergic. That can be a frightening factor for a patient going into CT scan. The CT scan machine is very big. Like I said, it's a giant circle that you just slide into, and it can be a little loud. That can also be intimidating for someone that's never experienced it. And just, especially when you're involved in a trauma or something's going on that, even a doctor can't figure out what's happening with you. They send you to CT, all those kinds of things. It could be a very scary thing going to CT scan. So, always considering our patients and making sure we put ourselves in their shoes is a very important perspective I have when it comes to working in the modality field too. So, yeah. So that is it for me in CT scan. Hope you guys liked the video and the presentation. Enjoy your break, everyone, and have a good one.